When ready to apply the NMES stimulation, wash and dry the skin and apply electrode gel to the electrode areas on the skin. For best results, you may want to trim any leg hair as well in the regions of the electrodes. Do not apply stimulation to recently shaved or broken skin. Open the conductive garment and remove the electrode covers from the top of the electrodes, exposing the sticky hydrogel surface of the electrode. The electrodes should be tacky and stick well to your skin. If the electrodes are dried out or not clean, replace them with the spare set of electrodes provided. Make sure to keep the electrode covers. They can be stored in the user interface pouch for convenience while applying the stimulation. While closing and tightening the conductive garment, verify the appropriate position of the electrodes and secure the strap ends to apply good compression to the knee and calf areas. Turn the power on to the user interface by sliding the on-off switch to the on position. The information button may be pressed to display the user interface hardware and software versions. The user interface screen will notify you to connect the user interface to an accessory. Attach the user interface cable to the conductive garment socket by aligning the logo on the connector and the logo on the garment socket. The user interface will display the available NMES treatments, post-op and strength. Select the treatment prescribed by your medical professional. On the stimulation level screen, you set the intensity of the stimulation levels for the knee and thigh areas. Each level begins with a setting of 0 and has a maximum setting of 100. In the knee area of the screen, press plus to increase knee treatment intensity until a strong but comfortable muscle contraction is achieved. When you hit the plus sign, electrical energy will be delivered to the quadriceps muscle, which some have described as feeling like a vibration or low-level buzz. Press minus to decrease knee treatment intensity as desired. Repeat this process for the thigh area until a strong but comfortable muscle contraction is achieved. The stimulation will oscillate between the knee and thigh areas. Note that it is common to have different intensity levels for the knee area and thigh area. Once the knee area and thigh area are set, select the Start button to begin the treatment program and the 20-minute countdown timer will begin. You can press the hard pause button at the bottom of the user interface at any time to pause the treatment. Hit Resume to resume the treatment. During treatment, the user interface will transition between periods of stimulation and periods of rest and will indicate when stimulation is active. The yellow symbol in the top right corner appears when energy is being delivered to the electrodes during the work period. The gray bar indicates that no energy is being delivered during the rest period. You can continue to adjust the stimulation intensity with the plus and minus signs as desired. You should only make adjustments during the work period. During stimulation and to protect the user interface from various home-related hazards, the user interface can be placed in the user interface pouch. For convenience, the user interface pouch can be attached to the conductive garment. At the end of the 20-minute treatment, the user interface will stop the stimulation and display a treatment complete screen. Turn off the user interface by sliding the on-off switch to the off position. Disconnect the user interface cable from the conductive garment by squeezing both sides of the cable connector and pulling away. To charge the user interface, make sure that the on-off switch is in the off position. Charge the user interface by plugging in the micro USB connector of the wall charger to the micro USB port. Plug in the wall charger. A blue LED light should be seen by the battery icon on the user interface to indicate that the battery is charging and should turn off when the charging is fully complete. Make sure to reattach the electrode covers to the electrodes after treatment is complete to keep the electrode hydrogel surface hydrated and tacky. The electrodes should last for many uses before they become dried out and need to be replaced. To replace the electrodes, peel the electrodes from the conductive garment and gently pull the white wire out from the hole. Detach the white electrode wire and reattach to the new electrode wire. Remove the hydrogel liner cover from the tan side of the electrode, exposing the sticky hydrogel. Stick the electrode back into the appropriate position. Push any exposed wire back into the wire hole in the garment.